Hello, my name's Dawn. I'm one of the nurses that would welcome you to E4. So what we do is we'll get a phone call from recovery to say that you're ready to come down to us, and then we make sure we have your bed space all ready, and you'll be brought down by the theatre staff onto the ward where a member of my team or myself will welcome you and settle you into the ward. We attach you to the bedside monitor, we attach you to the blood pressure machine, we'll offer you some water if you're allowed it, and then we'll take a handover from the nurse that's brought you down from recovery. Once we've got the handover, we'll come and make sure you're okay, check on how much pain you're in, if you need anything, then we can go down the route of phoning your next of kin if you like. And then we just look after you from that point on, and we'll encourage you to do as much as you can when you can. And part of the recovery is to get you out of bed quite soon, sometimes even on the same day of surgery, but I'm sure your consultants would have talked you through that, and other members of the team that you would have seen before you even went to theatre. So that's really important that you're on board with us and we can help you get out of bed, get you that pain relief that you need, and get you moving after your surgery straight away. Our team members consist of ward sisters like myself, nurses, we have band 4s now, so they're trained like nurses but aren't quite fully qualified nurses. And then we've got our lovely healthcare assistants, and we've got a ward host that you'll meet as well during your stay. So lots of people will be involved in your care to make sure that we can make this a positive and good experience for you while you're in hospital. One thing that's quite important to us as nurses is that we have good level of communication with yourselves, and that you feel that you're being cared for, and your needs are being listened to. So just please, when you come to us, don't be afraid to talk to us and ask us questions. And if you need anything or you have any questions, please, you must ask us. We're all here to make sure that you have a positive journey with us to your recovery, so that we can get you home to your family and your friends, and you know, as soon as we can. That's really important to us. Also you'll see physiotherapy teams while you're here. Sometimes we will just mobilise you without the physiotherapy team, and that's fine. We'll do that as well, because at weekends you may not see the physiotherapy team, but we will do it with you to make sure that you don't miss out on that therapy over the weekend. So they will come, they will see you, they will give you advice, and then we can assist you with that as well. So that's really important as part of your recovery, to be moving and mobilising as soon as you can. Do lots of deep breathing, lots of coughing, and we'll encourage you to do that as well, so that's important. Obviously you'll be in a bay with other patients, but we can offer you things like earplugs, eye masks, we've got headphones for the TV or radio if you wish. Most of the time our side rooms are allocated for patients that really need the side rooms, but most of the time you know, you'll probably be in a bay monitored by us with other patients around you. But our bays are quite nice in the fact that most of them have en suites with them, and it's a bed space of about 5 beds, so not a huge lot of people to share a room with. But again, if there's anything that we can help you with, if you're struggling at night, just let us know, and we can try and you know, help you get sleep, because obviously that's important for your recovery as well. Your first night on the ward after your surgery is normally quite a busy night, in the fact that we will check your observations and how you are doing through the night. Quite regimented. We will come to you every 2 hours to check your blood pressure, check your temperature, and check how you are doing, and that will be every 2 hours for that first night. So once you get through that first night, you'll see the team in the morning, and then generally we don't need to monitor you every 2 hours after that. But it's just so that you know the first night will be a 2 hour, but it will get easier after that, and sleep will get easier. We do offer a rest hour during the day, which is between 2 and 3 o'clock, and that just gets us to turn all the lights down, try and give you guys some peace and quiet away from the hustle and bustle of the ward, just for 1 hour during your day before visiting hour. Just gives you that time to rest, have a sleep if you can, and have that downtime. And then 3 o'clock we turn all the lights back on and we let things resume. That does include the therapy teams. They won't come during that hour. Obviously if there's important scans and things that need to happen, they will, but generally we do like to offer our patients the rest hour, 2 until 3, again just to promote that rest that you need. And it would have been very busy in the morning. There's generally lots happening in the morning. The ward is very busy and lots of people coming and going, so I think generally our patients really appreciate that 2 hour, that little 1 hour from 2 o'clock to get some rest and get some shut eye and just get some peace and quiet. So we really try and do that just to help your stay with us. You'll see the team in the morning because we have a ward round every morning where you'll know your plan for the day. When it comes to your discharge day, we've just got to wait for the team to draw up your paperwork so we can get your medications ready, and then we can let you know when your relatives or whoever it is can come and pick you up. It would be really helpful for us as well if you can feed back to us how your stay with us has been, just so that we can get ideas from you, any suggestions, and we just like to know if people have generally had a nice stay with us, because obviously people don't want to be in hospital really. So it would be lovely to get your feedback. We have feedback forms, so we can give you one before you go, and then we can post that off, and it's lovely for us to know how your stay was. Medications can take a little while, so we have to send them down to pharmacy to be screened, but if we can try and get it done quickly on the ward. Depends really what medications you're on, but generally we can try and get it turned around quickly for you for your stay.